Most older men believe that if they stop masturbating, nothing serious will happen. But the truth is, when you stop sexual activity completely, changes start happening inside your body that most men never see coming. Some of these effects may quietly steal your confidence, your energy, and even your health. In this video, I'm going to reveal exactly what happens to your prostate, your erections, your hormones, your heart, your emotional well-being, and your overall vitality if you stop masturbating in old age. This is based on real science and what I see every day in my urology practice. We will talk about how reduced prostate drainage may increase your risks, how your erectile tissues start to weaken, how your testosterone balance is affected, how your circulation suffers, and how your emotional health can slowly decline without you even noticing. And I will show you the early warning signs your body gives before these problems fully take hold. Make sure you watch until the very end because the first warning sign I reveal is the one that almost every man ignores until it's too late. Before we get started, type your city in the comments below. I want to know where you're watching from, and if you find this information valuable, please like this video and subscribe to Glowing Age. Your support helps me create more doctor-approved lessons that truly make a difference. Reduced prostate drainage and health risks. Most men never realize what silently happens inside their bodies when sexual activity, including masturbation, stops completely. The prostate, which plays a central role in male sexual health, is deeply affected by this change. As a urologist, I've seen how overlooked this problem is, especially in men over 60. The prostate is responsible for producing the majority of the fluid that makes up semen. During ejaculation, this fluid is released, helping to clear the ducts and maintain healthy prostate function. When ejaculation becomes infrequent or stops entirely, that fluid doesn't just vanish. Instead, it sits inside the prostate. Over time, stagnant secretions may contribute to a process we call prostatic congestion. Prostatic congestion is not a term most men hear, but it's something I deal with regularly in my clinic. The buildup of unreleased fluid can cause the prostate to swell slightly, leading to discomfort, a feeling of pelvic fullness, or even mild chronic pelvic pain. In some cases, it contributes to inflammation, known medically as prostatitis, which can trigger burning sensations, urinary difficulties, or pain during ejaculation when sexual activity resumes. More importantly, several studies suggest that regular ejaculation may play a protective role against more serious prostate diseases. One of the most well-known studies comes from Harvard University, where researchers tracked over 30,000 men for nearly 20 years. They discovered that men who ejaculated 21 or more times per month had a significantly lower risk of developing prostate cancer compared to those who ejaculated 4 to 7 times monthly. While the exact reason behind this association isn't fully understood, the theory is straightforward. Regular release may help flush out potentially harmful substances, reduce inflammation, and maintain healthier tissue function. Without this regular drainage, not only can congestion occur, but the stagnant fluid may foster an environment where inflammatory processes develop more easily. Chronic low-grade inflammation in the prostate is something I routinely detect during evaluations, even in men who feel otherwise healthy. Over time, inflammation damages cellular function and may contribute to the cellular changes that raise cancer risk. One patient, William, age 69, came to my office complaining of increased nighttime urination and occasional pelvic discomfort. He had stopped all sexual activity after his wife passed away 5 years earlier. We performed a full evaluation and ruled out major conditions like infection or cancer. However, his prostate was mildly enlarged and tender, a classic sign of prostatic congestion. After discussing his history, we agreed that safe, regular sexual activity, even through masturbation, could help relieve his symptoms. Over the next several months, William reported a gradual reduction in discomfort and better urinary control. This is not an isolated story. I've seen countless men improve their prostate health with safe, consistent ejaculation habits. While masturbation is not a replacement for regular medical care or screenings, it can serve as a simple, natural practice that helps maintain prostate health as part of a broader wellness routine. It's important to understand that completely stopping ejaculation doesn't guarantee prostate problems, but it does remove one of the body's natural maintenance processes. Especially for men over 60, where prostate growth and inflammation become more common with age. Supporting the gland through regular function can make a real difference in long-term comfort and health. As your body ages, simple habits can have powerful effects. Regular, safe ejaculation is one of those habits that quietly supports your prostate and helps protect against the very problems so many older men fear but rarely discuss. Loss of erectile tissue elasticity. Many men believe that if they lose interest or stop sexual activity as they get older, their body simply adjusts and nothing much changes. Unfortunately, that's not how the male sexual system works. When regular erections stop, even if unintentional, changes begin to occur inside the penis that most men can't feel right away. But over time, they become very difficult to reverse. The penis relies on a delicate balance of blood vessels, smooth muscle fibers, connective tissues, and nerves. Erections work by filling spongy tissue inside the penis with blood, stretching and expanding these structures. This regular expansion is what keeps the tissues soft, flexible, and functional. But when erections become infrequent or stop altogether, the tissues lose that regular stimulation and begin to change. Inside the erectile chambers, tiny blood vessels called capillaries deliver oxygen-rich blood during every erection. Without regular blood flow, these capillaries don't open as often. Over time, reduced oxygen supply can cause some tissues to develop fibrosis, a process where healthy elastic fibers are slowly replaced by stiffer scar-like tissue. This makes it harder for the penis to expand fully and achieve firm erections. I often compare this to muscles or joints. If you stop moving a joint, scar tissue forms, flexibility decreases, and stiffness develops. The same principle applies to erectile tissue. Without regular use, you gradually lose elasticity, and erections become weaker, shorter lasting, or more difficult to achieve at all. One patient of mine, Gerald, 72, came to me frustrated that his erections had become unreliable over the past few years. After his wife passed, he had stopped all sexual activity, thinking that at his age it no longer mattered. But when he later entered a new relationship, he found that his body was not responding like it once did. After examining him, I explained that the decline wasn't unusual. His erectile tissue had likely lost some flexibility simply because it hadn't been used regularly. Fortunately, there are ways to slow or even partially reverse these changes, but early prevention is far more effective. Regular erections, whether through partnered intimacy or masturbation, help preserve the flexibility of the smooth muscle fibers, maintain healthy blood vessel function, and stimulate nitric oxide release, a chemical that relaxes blood vessels and promotes circulation. Scientific studies support this. Research published in the Journal of Sexual Medicine has shown that regular sexual activity is linked to better erectile function in aging men. Even men without partners who maintain erections through masturbation experience better preservation of erectile ability over time compared to men who remain completely sexually inactive. The process of fibrosis doesn't happen overnight. It's gradual, taking years to fully develop. That's why many men don't realize it's happening until erections suddenly become more difficult. Once scar-like tissue forms, treatments become more complex, often involving medications or even invasive procedures. The message I give my patients is simple. If you want to protect your ability to achieve strong, reliable erections as you age, don't wait until problems appear. Maintaining regular erections, even through safe masturbation, helps keep the erectile tissues oxygenated, elastic, and functional. It's a small, private habit that quietly supports one of the most important aspects of male health and confidence well into your later years. Testosterone and hormone balance disruption. Most men know that testosterone naturally declines with age, but what they don't always understand is how lifestyle and sexual activity can quietly influence these hormone levels even further. When sexual activity, including masturbation, completely stops, it can have a surprising effect on your hormonal balance. Testosterone plays a critical role in maintaining energy, muscle strength, mood, mental clarity, and of course, sexual function. After 60, many men already experience lower testosterone levels due to the aging process. But the body is highly responsive to sexual stimulation. When you engage in sexual activity, your brain signals a cascade of hormonal responses that include increased testosterone production. Without these signals, your body has one less reason to maintain optimal hormone balance. Several studies have shown that sexual activity may help support healthier testosterone levels, even in older men. Research in journals like Psychoneuroendocrinology has demonstrated that sexually active men often have higher circulating testosterone than men who are sexually inactive. This doesn't mean that masturbation will dramatically boost testosterone, but stopping sexual activity altogether can allow levels to drop more than they might naturally. The indirect effects can be even more significant. Sexual activity helps reduce stress, and lower stress means lower cortisol, the primary hormone your body releases when you're anxious or under pressure. High cortisol levels suppress testosterone production. So when sexual activity stops, not only do you lose the stimulation that supports testosterone, but you may also experience rising cortisol that further suppresses it. One of my patients, Raymond, 67, visited me complaining of low energy, poor motivation, and declining libido. His testosterone was borderline low, but not yet at a level requiring medication. After reviewing his lifestyle, it became clear he had withdrawn from sexual activity entirely following a divorce. I explained that sexual inactivity might be playing a role in his declining hormone balance. Together, we developed a plan that included safe, regular masturbation, along with sleep improvements, exercise, and stress management. Within months, Raymond noticed improvements in his mood, energy, and interest in intimacy. Another often overlooked hormonal factor is prolactin. After orgasm, prolactin temporarily increases, which plays a role in sexual satisfaction and the recovery period. Regular sexual activity helps keep the body's hormonal rhythms in balance, contributing to a stable, predictable hormonal environment. The message here isn't that masturbation is a magic fix for low testosterone. But for men over 60, maintaining some level of regular sexual activity can help preserve the hormonal cues your body relies on to support testosterone production and maintain hormonal stability. When hormone balance is disrupted, men often experience more than just sexual symptoms. They may struggle with irritability, muscle loss, weight gain, poor sleep, and even mild depression. By continuing regular, safe sexual stimulation, you help your body stay hormonally active and responsive. As your body ages, you want to protect every system working quietly in the background. Your hormones are no exception. A simple, consistent routine that includes sexual activity helps support your body's natural hormonal rhythm, keeping you stronger, sharper, and more energized as the years go by. Cardiovascular and circulation decline. Many men don't realize that every erection is not just a sexual event, but also a cardiovascular event. The health of your heart and blood vessels is directly linked to your ability to achieve and maintain an erection. When sexual activity, including masturbation, stops entirely in older men, the consequences often extend far beyond the bedroom. Erections depend entirely on healthy blood flow. Nitric oxide, a molecule released during sexual arousal, signals blood vessels to relax and expand, allowing blood to fill the erectile tissues. This same process benefits the entire cardiovascular system. Regular erections keep these vessels flexible, responsive, and active. When erections stop happening regularly, the blood vessels inside the penis and throughout the body may slowly lose their ability to dilate efficiently. Endothelial function, the ability of blood vessels to expand and contract properly, naturally declines with age. But regular sexual activity helps stimulate and preserve this function. Without that regular stimulation, endothelial health deteriorates more quickly, contributing to both erectile dysfunction and broader cardiovascular concerns like high blood pressure, arterial stiffness, and reduced circulation. Scientific studies support this connection. Research published in the American Journal of Cardiology and European Heart Journal has shown that men who maintain regular sexual activity including masturbation, often have better cardiovascular health and a lower risk of heart disease compared to sexually inactive men. While sexual activity isn't a substitute for exercise or proper diet, it serves as a valuable and often overlooked form of gentle cardiovascular stimulation. One of my patients, Leonard, age 70, came to me with growing concerns about both his erectile function and his heart health. He had withdrawn from sexual activity for years, assuming that it was safer given his age. But when we reviewed his cardiovascular markers, we found early signs of reduced circulation and declining vascular flexibility. I encouraged him to make several changes: walking daily, improving his diet, and slowly reintroducing safe sexual activity, including masturbation, to stimulate blood flow naturally. Over the next year, not only did Leonard's erections improve, but his blood pressure and cholesterol levels stabilized, and his energy levels increased. Another important factor is oxygen delivery. Erections allow oxygen-rich blood to flow into the penile tissues, nourishing the smooth muscle fibers and keeping them healthy. Without regular erections, these tissues don't receive the oxygen they need, leading to gradual tissue damage, fibrosis, and further impairment of erectile function. This creates a dangerous cycle. Poor circulation leads to fewer erections, and fewer erections worsen circulation even more. Sexual activity also triggers the release of nitric oxide systemically, helping to support overall vascular health. As men age, nitric oxide production naturally decreases, but sexual activity remains one of the body's ways to stimulate its release. While many focus on medications and lifestyle to manage heart health, very few realize how sexual activity, even masturbation, quietly supports circulation. This simple act helps preserve vascular responsiveness, maintain healthy arteries, and indirectly support your heart. For men over 60, protecting your circulation is one of the most important things you can do to safeguard not only your erections, but your overall longevity. Maintaining regular, safe sexual activity is one more tool to keep your cardiovascular system strong and functioning well as you age. Emotional and psychological impact. When most men think about stopping sexual activity, they focus on the physical changes, erections, hormones, prostate health. But what many don't expect is how deeply sexual withdrawal can affect their emotional and psychological well-being, especially after 60. Sexuality isn't just about physical pleasure. It's tied to a man's identity, confidence, emotional stability, and sense of connection. When masturbation and sexual activity stop entirely, men often feel they are surrendering an important part of themselves, even if they don't speak about it openly. As a urologist, I see this regularly. Many older men who stop sexual activity begin to experience subtle emotional shifts. They may feel a growing sense of loneliness, irritability, sadness, or loss of purpose. Over time, these feelings can quietly build into more serious problems like depression or social withdrawal. One of my patients, Arthur, 73, visited me after several years of complete sexual inactivity. He initially came in for fatigue and loss of motivation, but as we spoke, it became clear that the absence of sexual activity was contributing to his emotional struggles. Arthur had lost not only his physical intimacy, but also the comfort, relaxation, and emotional release that came with sexual expression. We worked together on a plan that included safe, regular masturbation, social engagement, and counseling. Within a few months, Arthur reported improved mood, better sleep, and a stronger sense of self-confidence. Sexual release triggers the release of several important brain chemicals: dopamine, endorphins, oxytocin, and serotonin. These chemicals help regulate mood, relieve stress, improve sleep, and create a sense of satisfaction and well-being. When sexual activity stops, the body loses one of its natural ways to stimulate these mood-balancing chemicals. Stress management is another critical factor. Aging often brings new sources of anxiety, health concerns, financial pressure, loss of a spouse, or reduced social interaction. Masturbation, when practiced safely and in moderation, offers a natural form of stress relief. The relaxation that follows orgasm can lower cortisol levels, ease anxiety, and promote better emotional balance. For many men, especially those living alone or who have lost partners, masturbation remains one of the few intimate experiences they can control. It offers privacy, familiarity, and emotional comfort during times when intimacy with others may not be available. It's important to understand that this isn't about replacing meaningful relationships, but about preserving a healthy connection to one's own body and emotional needs. Complete sexual withdrawal can amplify feelings of isolation, while healthy sexual expression, even privately, helps maintain emotional stability. I always remind my patients that sexual health is about far more than the physical act itself. It's about feeling whole, connected, and alive. Protecting your emotional health as you age means acknowledging how important sexual expression remains, even when physical changes occur. If sexual activity has stopped completely, and you notice growing feelings of sadness, anxiety, or loss of confidence, don't ignore these signs. Reintroducing safe, healthy sexual habits can play a quiet but powerful role in restoring emotional balance, helping you feel more centered, more stable, and more like yourself. Early warning signs you're being affected. The changes that happen when you stop sexual activity don't usually appear overnight. Instead, they creep in slowly, often so gradually that many men don't recognize the warning signs until significant problems have developed. As a urologist, I teach my patients to watch for these subtle early signals. Catching them early gives you the best chance to take simple actions that can preserve your long-term sexual and overall health. One of the first warning signs many men notice is a reduction in morning erections. These spontaneous erections are not just about sexual readiness. They are a critical indicator of vascular health and hormonal balance. If you notice that your morning erections become less frequent, softer, or stop entirely, it may be a sign that blood flow, tissue elasticity, or hormone levels are starting to decline. Loss of sensitivity is another common early symptom. Men often report that stimulation no longer feels as intense as it once did, or that it takes longer to reach climax. This reduced sensitivity can result from gradual nerve desensitization or reduced blood flow in penile tissues that are no longer being regularly stimulated. Urinary problems can also serve as a red flag. Infrequent ejaculation may contribute to prostate congestion or low-grade inflammation, which can lead to increased urinary frequency, nighttime urination, weaker urine stream, or pelvic discomfort. While these symptoms can have multiple causes, a sudden or progressive change may signal that your prostate is no longer functioning optimally. Mood changes are frequently overlooked but very important. Increased irritability, low energy, reduced motivation, or feelings of mild depression may result when sexual activity stops and the brain no longer receives the positive hormonal and chemical signals triggered by sexual release. These emotional shifts often occur quietly and can easily be mistaken for simple aging. Fatigue and changes in overall vitality are also common early indicators. When testosterone levels decline or cortisol remains elevated due to chronic stress without proper release, men often report reduced stamina, slower recovery from physical activity, and overall loss of drive. One of my patients, Edward, 71, came to me reporting many of these symptoms over the course of a few years. He had fully stopped sexual activity after his spouse's passing and hadn't recognized that these seemingly unrelated changes could be connected to sexual withdrawal. Once we identified the pattern, Edward was able to reintroduce safe, regular masturbation along with other healthy habits. Within several months, his energy improved, mood stabilized, and he regained confidence in his physical and sexual well-being. Recognizing these early warning signs doesn't mean something is permanently broken, but it does mean your body is quietly signaling the need for action. Regular, safe sexual activity, even through masturbation, can help reverse many of these trends before they progress into more serious, harder-to-treat conditions. Your body is always communicating with you. By paying attention to these small changes, you give yourself the power to stay ahead of aging's more challenging effects, preserve your health, and maintain the vitality that makes life rewarding well into your senior years. Now you know what can happen when you stop masturbating in old age. The effects are slow but real. They affect your prostate, your erections, your hormones, your heart, and even your mood. But the good news is many of these changes can be prevented or even reversed by taking simple, safe steps. Remember, sexual health is not just about pleasure. It's about protecting your confidence, your vitality, and your overall well-being as you age. If this video helped you, please like it and subscribe to Glowing Age. Your support allows me to keep bringing you clear, science-based advice that helps you thrive after 60.